Welcome, Dr. Ealy.
How are you doing, Sayer? It's so good to see you and be on this show.
Oh, it's such an honor, truly. I've been really familiarizing myself with your work, and it's just such an inspiration. Of course, we wouldn't be doing this here today if it weren't for your work. Can you briefly tell our viewers how your team figured out that the COVID data was being manipulated?
Well, first of all, I'm blushing a lot. Thank you so much for the high praise. I think we started on March 12th of last year, and that's where we began our investigation. We wanted to understand what we could expect so that we could do public service announcements for everybody and just keep people really calm because there was so much fear going on. So we looked at the Italian data from the Italian Ministry of Health. We looked at the South Korean data from their CDC, and we started to really analyze that data. And our first clue when we started to overlay the bell curves, Sayer, was the anomaly spikes in cases here in the United States. Something wasn't matching up. So we said, we got to look deeper state by state. So then we had a major breakthrough when we went and we looked at and found a huge variance in fatalities between what the U.S. was saying, the CDC was saying for the U.S., specifically in the state of New York, and what the New York State Department of Health was saying. So on April 30th, the CDC was reporting 5,306 more fatalities than the New York State Department of Health. And that number's only grown. As of yesterday, that number is now 8,496. The CDC for the state of New York is reporting 8,496 more fatalities than the New York State Department of Health. So we wanted to know which number could we trust, which number was right. So curiously, at the bottom of the CDC's previous website on COVID tracking, they had a little link to an April 15th document. That document was a position paper that they had adopted from the Council of State and Territorial Epidemiologists. And it was incredibly poorly conceived, in my professional opinion. There were very loose criteria for diagnosis. They allowed the same person to be counted over and over and over again as new cases. But more importantly, it was adopted by the CDC without public comment, without peer review, and without notification in the Federal Register, which are required by federal law. We didn't know that at the time, but our research ultimately led us there. So at this point, we're super shocked, right? And all this information is hiding in plain sight. The data was clearly compromised, and no one at the state and federal level seemed to care because we reached out to them and we were trying to get them to correct it, but nobody got back to us. We were just dismissed. So we couldn't believe that the CDC would outsource the criteria for what constitutes a COVID case, to a nonprofit organization, the Council of State and Territorial Epidemiologists. They're not a federal organization. So we're like, something doesn't smell right. So that made us dig even deeper, and it ultimately brought us to the CDC's publication of the COVID Alert number 2 document that completely changed death certificate reporting, but only for COVID-19, and again, without public comment, peer review, or notification in the Federal Register as required by federal law. So just to give everybody a background, for the previous 17 years, all changes to data collection were first reported to the Federal Register for oversight and public comment. That's the law. For the previous 17 years, for all causes of death, death certificate reporting was very different and under complete discretion of the attending healthcare professional. It wasn't under the CDC telling them what to do. But now with COVID, they're being told what to do. They were being told to emphasize COVID even without a confirmed lab test. They were being told to simultaneously de-emphasize chronic comorbid pre-existing conditions that we knew from the Italian data and the South Korean data played a huge role in patient outcomes. And what we later learned was that these changes in death certificate reporting were financially incentivized to encourage compliance, something Dr. Scott Jensen from Minnesota, senator out of Minnesota, was vilified for, and then ultimately it was found to be accurate, everything he had said. So what we're hearing now, Sayer, is that public health officials keep saying that minority communities are being disproportionately impacted. I just read it on ESPN today. But what that implies is that COVID is impacting us more than that. And that's just not accurate. It's not accurate to say that COVID is impacting minority communities more. What's accurate is to say that our communities have a higher incidence of comorbid conditions because we're in a worse state of health, because That is due to systemic socioeconomic, educational, healthcare inequalities. These are things that are beyond dispute, and it's been going on for hundreds of years. The SARS-CoV-2 virus, Sayer, doesn't care what color your skin is. It cares how little vitamin D you have. It cares how little vitamin C you have. It cares how little vitamin A and zinc you have in your body to fight it. The SARS-CoV-2 virus is just another opportunistic infection that preys upon people who are nutritionally deficient, which tells us exactly what we need to help everyone in our country. So by this point, with everything that we've researched, we know something is very wrong. And when we have inaccurate public health narratives supplanting real science, our concerns skyrocket, Sayer. So we wrote a series of investigative research papers. We got the fourth one peer reviewed. That's what we're going to talk about today. We got a fifth one on the way. And tell you the truth, we can't wait to get started.
Wow, thank you so much for that, Dr. Ealy. It's incredibly inspiring to witness yourself and all the panelists today, put themselves on the line in this way, just dedicated to providing the public accurate information despite political fallout. And your work, that paper really just blew my mind. As I know many of the viewers, when you take a look at the two papers you put together, it really does show that what we predicated an entire national lockdown upon, and all of these interventions that are so devastating, including social isolation or /distancing and mask wearing, what you're doing is helping to return us to a basis of sanity. And of course, that is what this event is all about, is making that information available. Would you have anything else to contribute before we move on to the roundtable?
Just real quick, Sayer, I agree with you, and I want everybody watching this to be very clear. Our intention is to collaborate with public health officials. Our intention is to collaborate with good people in the CDC. There are good people in the CDC. There are good people in state health departments. There are good people at the county levels and doctors out there. We want to collaborate with you and get this information out. If we can put all this money behind promoting the experimental biologics, we can promote vitamin D as well. It just makes sense, doesn't it?
Absolutely. I mean, all we're asking for is that the laws that were already in place, federal law, was basically not observed or violated. And in this case, the implication was it affected the lives of tens of millions in a significantly adverse way. So this is a true call for sanity, clarity, and also cooperation among those individuals that are paid by the taxpayer and some who are elected that are supposed to be watching out for the public health. So we are partnering with those individuals as well, not necessarily in opposition to them.